So dental implants are super exciting. It's what we're talking about in the dental profession probably most often. It's the buzzword. Dental implants are what we hear about on TV, what our friends and family are talking about when they lose a tooth, about getting a dental implant. So it is super exciting, which is great for me because I'm a periodontist who specializes in dental implants. So a dental implant, patients will typically have three things that they want to know about when they come and see me for a dental implant. How much is it going to cost, how long is it going to take, and how much is it going to hurt? And really those questions are pretty straightforward to answer. The cost question is a very valid one, and it's a great question to have. So, but it's an easy one to answer. It's about the cost slightly more than what a dental bridge would be, which is great news because the studies show that dental implants, if they're maintained and taken care of, will last longer than a bridge. So if you're investing in the long term, a dental implant would be a better way to go, in my opinion. The next thing is how long is it going to take, and in some cases we can take out the tooth and we can place the implant the same day. Some cases are not candidates for that, and we will need to correct the site before we place the implant, whether it's a bone correction or a soft tissue correction. Sometimes those things need to happen before you place the implant, which will just increase the time, unfortunately. The last thing they're worried about or have concerns about is how much is it going to hurt. There's good news there also. So the reason you're losing the tooth is typically more painful than placing the implant, having the implant. Sounds scary because we're placing a piece of titanium in your jaw, and it sounds like that would be the most scary part. However, the tooth extraction or the infection or the cracked tooth, whatever it is, that is typically more painful than having the actual implant placed. Now, dental implants are great. They're great options. And if it were me, and at some point I will probably need to have one. I've had dental work just like everybody else. I will choose to have a dental implant. In fact, family members I've done implants for, and I would recommend other family members and other friends to have dental implants. Here at Sundance Implant and Periodontal Center, we are interested in not only getting an initial implant to take, but we're interested in your long-term success. And that's why we've invested in all the technology that we have, whether it's a cone beam CT scanner, to verify placement of the implant, to verify how much bone and soft tissue we are working with. So we can get an implant initially to integrate into your jawbone. However, we're interested in the long-term success. We want to see you healthy and happy for many, many years. So that's why we have invested in our patients through this different technology. Dental implants, the price is all over the board, and it's very competitive. So it's important that patients know what they're getting, and if that fits their model for their oral health, then great. It's important for them to be aware that there are different implants. Most of them will integrate. It's just like a car. Some cars are better than other cars. Say for a Honda versus a Hyundai, for example, one car will last longer and you'll have less problems with it. We've invested in our opinion, the best implant on the market, which is greatly appreciated by our patients because they have less maintenance or issues with them.